Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the pharmacology of co-trimoxazole. Co-trimoxazole is a combination of trimethoprim and sulfamethoxazole. This combination shows greater antimicrobial activity. Sulfamethoxazole and trimethoprim combination is less resistance to either of the drugs alone against the bacteria. Mechanism of action: the synergistic antimicrobial activity of two drugs combined in one. So this is a synergistic combination. Inhibits two sequential steps in the synthesis of tetrahydrofolate. Like this, sulfamethoxazole inhibits incorporation of PABA. PABA means para-aminobenzoic acid into the folic acid, and trimethoprim prevents reduction of dihydrofolate to tetrahydrofolate. How about the antibacterial spectrum? Co-trimoxazole is a broad spectrum antibiotic. It covers many antibiotic activities against many bacteria. It is effective in treating urinary tract infection, like the infection of the kidney, infection of the ureter, bladder, infection of the urethra, and the prostate, as well as it also works in prostatitis, management of prostatitis, management of vaginitis, because this drug goes to the vaginal fluid, to the prostatic fluid. It is effective in respiratory tract infection. It is useful in the management of pneumonia, like Legionnaire pneumonia or Haemophilus influenza pneumonia. Also, it is useful in pneumocystis jirovecii pneumonia that is found in case of HIV-infected patient when their CD4 count is very low. Then this is the drug of choice. Gastrointestinal infection, it may be Salmonella typhi or non-Salmonella typhi infection, non-typhi infection by Salmonella, and also for against Shigella. It is a very good medication in the management of gastrointestinal infections. Pharmacokinetics: trimethoprim is more lipid soluble than sulfamethoxazole and has a greater volume distribution. The combination is 1 part trimethoprim to 5 part of sulfamethoxazole. Generally used orally, but can be used intravenously in HIV-infected patients. The drug crosses the blood-brain barrier. We know that blood-brain barrier is formed by the foot plate of astrocyte and the tight junction between the endothelial cell in the central nervous system. It is mostly the tight junction between the endothelial cell, supported by the foot process of the astrocyte. So this drug, co-trimoxazole, can cross the blood-brain barrier slowly and is excreted unchanged through the urine. So it is excreted in the unchanged form. Also, its metabolites are also unchanged, and that is found in the urine. What are the adverse effects of co-trimoxazole? It has many adverse effects. Skin rash is very common, especially in the elderly. Gastrointestinal problem, nausea, vomiting, glossitis. There is the inflammation of the tongue, stomatitis, inflammation of the oral cavity, especially the oral outline between the lip, are not uncommon. Hematologic, this is a drug, very effective, but it may cause megaloblastic anemia, so the RBC size will be increased but there will be anemia. Leukopenia, decrease in number of the white blood cell. Thrombocytopenia, decrease in the number of the platelets or thrombocyte. So this adverse effect can be prevented by giving folinic acid. HIV patients may show drug-induced fever, rashes, diarrhea, and pancytopenia. Pancytopenia is the decrease of all type of cell, all type of blood cell, like RBC, WBC, and platelets. Drug interaction, this medication, co-trimoxazole, may interact with phenytoin, so it increases its half-life. So if the phenytoin half-life is increased, then it may cause more toxicity, like that. Methotrexate. Plasma level increases due to displacement of methotrexate from the albumin by the co-trimoxazole. Again, the adverse effect or toxicity of methotrexate will be increased. And this is a very popular medication with many commercial name like Septrin, Cotrim, Bitrin, Umset, a lot of names by different pharmaceutical industries. Easy to take, usually 2 pills 2 times daily. Okay, for at least 5 to 7 days or as prescribed by the physician, registered physician. So this is a very, very good medication, only 2 times therapy, and it is a very popular medication, also cheaper. But we have to concern about the adverse effect and the drug interactions. And that's all about the pharmacology of the co-trimoxazole. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.